Hello, my name is Dr. Faslanwar. Today we will discuss a case of a polar cataract in a patient. Now you can see here the pole is blocked and we will stain the anterior capsule first so that we can perform capsulorhexis in this patient. Now you can see we are removing the vision blue dye. Now after removing the dye we will inject some xylocaine adrenaline so we can get more dilatation of the pupil. Now after dilating the pupil, we will put in viscoelastic gel into the anterior chamber. Now do remember, we need medium sized capsular axis so that we can perform hydrodelineation. In such cases, we usually don't perform hydrodissection. Now you can see here I am trying to perform capsular axis in this patient up to the level of iris or near the iris so we can get adequate capsular axis. Now after completing this anti-clockwise circle, now we are done with the capsular axis. Now we will make a side port of 15 degree. Always remember, good hydrodelineation in such cases in the layer wise fashion is very important. Now we will perform hydrodelineation in a layer wise pattern. Now this is a central layer, now this is mid peripheral layer, and now again in the opposite direction this is the extreme peripheral layer. This is now we are done with the three layers. Now we will try to pull out the centralmost part of this bulkiest part of this nucleus. So now we will separate with this water in all direction so hydrodelineation is complete. Now you can see there is no hydrodissection that was performed due to polar cataract in such cases. Now mostly I have seen polar cataracts, they get separated from the posterior capsule when they keep on hydrating or keep on getting the water wave. Now we will use the pico tip so that we can go into the anterior chamber and remove the central part of the delineated nucleus. Now you can see we are removing the epinucleus or cortical matter. After removing the cortical matter, we will now lift the edge of the centralmost part. Always when you have to lift it, you need to hold the edge. Now you can see here edge. Now after as we hold the edge, the nucleus will flip and come into the tip of the pico probe. Now the nucleus central part is removed. Now you can clearly see the pole with the polar cataract. Now we will hold the second layer. Now as we hold the second layer, mostly whole of the bulkiest part of the nucleus starts coming. Now we will gently pull all segments so that we can separate it from the capsule. Here you can see we have separated most of the parts of the capsule. Here you can see now after removing the most of the parts of the capsule, we will use Simcoe cannula so that we can separate the superior part or 12 o'clock portion. Now you will see in such cases the central thick part keeps in the visible part, so we will not pull that part, only the sides will be separate. Now you can see we have separated the 12 o'clock part. Now all the parts will be separated. Now this is the part that is around 8 o'clock. Now it will be separated. After separating the all portions and making sure that none of the parts of the nucleus or the epinucleus is attached with the capsule, and then we will hold the part again. So keep on hydrating it. Now as the water wave will automatically go back, and this portion of the epinucleus you will see start floating in the air. Now the epinucleus layer is almost separated from the posterior layer, and now this part will automatically start floating. Now when the posterior connection is separated, the epinuclear part will start floating. Now we will use paddle to now you can see, to fold this part of epinucleus. Now you can see the very beautiful another layer of epinucleus is separated, that was adherent to the pole, and now we will remove this part. Now this part is also removed. The only part that will be left will the posterior cortical layer and the thin sheet of attachment. Here you can see this part is removed. Now you can see still visible central thick portion. Now this is the last part, and you can see as the water will go back, it will safely remove this part, and now that the whole of the sheet is separated by ballooning effect that you just saw, and you can see the central wide scar is lifted safely. Now this is only possible because of the continuous water irrigation to the central part of the cataract. Now we are very much relaxed as we have separated the central part. Now we will safely remove it, as we have seen that there is no defect behind. Now this is the thick portion that is to be removed from the posterior capsule. I'm still trying to see the posterior capsule for any injury if present. Now I'm very much sure that there is no problem with the posterior capsule and the capsule is perfectly fine. I am separating this part. When you don't dial the nucleus, it is very difficult to remove the epinuclear components because the dialing separates the adhesions between the cortex and the epinucleus. Once you have not dialed the nucleus, you have not performed a hydrodissection, you have to be very gentle in removing these parts because they will take time. Now you can see I have lifted it and now I am removing it slowly, and now the whole of the part is separated from the peripheral areas. You can see the whole of the nucleus cataract or epinuclear cataract is removed. Now you can see safe and secure posterior capsule in this patient. It is only possible because of the slow water hydration of the capsular area. If you want to perform such cases in quick time, then they can end up with the complications or the capsular defect. Now the cortical matter or the threads are removed one by one. Now we will put in the gel, we will put in some gel and then the foldable intraocular lens into this posterior capsular bag. You can see shining cornea and shining posterior capsule in this case. Now we will put in this foldable aspheric medi-contour intraocular lens into the bag of the patient. You can see beautifully it has gone into the posterior, into the bag, and the posterior capsule is fully intact. Now we will guide the lens into the bag with the help of the dialer. So the other haptic is also settled into the bag. Do remember, these cases are very tricky cases, and you can perform these cases very well if you perform all the steps very gently and follow the guidelines and the steps that are recommended. If you try to perform or do such cases in quick time, then it can create, or these cases can create some problem for you, and you have to deal them with other complications. The case is done and it is very clear. Lens is settled, the gel is removed, the lens is centered, and now we are checking all the areas for any debris, any gel into the anterior chamber and the port areas. Mostly the fibers are trapped in the port areas. So I hope that you will learn from this cataract. This patient also had multiple problems. Now the case is very beautifully performed, and the next day we will see the follow-up in this patient. A shining lens and neat and clean anterior chamber.